Dr. Daniela Steyn is a family physician. She's associate professor at McMaster University. She's a speaker and educator. She's a Team Canada triathlete as well, and clinic director of Wellness MD in Oakville. And her book is fantastic. It's called Thrive Through Menopause, and her Wellness MD podcast. Both are very, very good overviews of her holistic and lifestyle-based approach to optimizing health. And I believe you're a member of the Lifestyle Medicine Academy in the States as well, correct?
Yes, you're right.
Yes. Okay, excellent. So I will turn it over to Dr. Steyn. She's going to be talking with us about some of the weight loss medications that are available.
Sounds good. Thank you so much for having me, and Dr. Julia Fontaine, thank you so much for hosting this. Thank you for your incredible, insightful talk. It was next level. You should take your talk and put it just like that into a book. It's really good. It's a very good overview of menopause and very concise. It's really good. And then, as you said, I have a menopause clinic, a weight loss clinic. I'm passionate about menopause. That's why I wrote the book. And the goal of the book really was to help people who do not want to go onto hormone therapy, to guide them, what are the other strategies we can do, the other things we can do. That being said, I do prescribe a lot of hormone therapy. So my perspective at the time was, if you go to your doctor, you can get hormone therapy. And then if you do not want hormone therapy and you're not sure what else is out there, that was the aim of my book. But then since the book came out, and I'm grateful, the book became an international bestseller and I got a lot of emails since, I realized that there was actually more medical help needed than I thought. And the same with the Ozempic. There's a lot, and that's why what my talk will be about tonight is because there is so much on TikTok and Instagram that people kind of feel lost between facts and between the research and how does it apply to them. So I have, myself, as you said, I'm double board certified through the American Board of Lifestyle Medicine. Through the American Board of Lifestyle Medicine, we learned about everything that we can do to reverse illness. So obesity and diabetes are both chronic diseases. Typically, with a chronic disease, we can't reverse it unless we do it with lifestyle changes such as diet and nutrition and movement. Whereas any drug that we give for those illnesses will manage it. And I'm specifically talking about Ozempic tonight. But Ozempic is not a miracle cure that's going to cure that chronic disease. If you've been diagnosed with obesity or being diagnosed with type 2 diabetes, it's typically a chronic disease. So taking a medication won't take your disease away. The only way that you can take your disease away would be with lifestyle changes to completely change the things that brought on the type 2 diabetes or brought on you being overweight. So let's talk about Ozempic. I want to give you a little bit perspective about Ozempic. It's a medication called semaglutide. And semaglutide is the ingredient. Ozempic is just the brand name. There's another brand name for it, Wegovy. But then it is in a class of drugs called GLP-1 receptor agonists. And just some background, GLP-1 receptor drugs has been around since 2005. So it's not that new. I've been prescribing it since 2010. At that stage, we had Victoza, which was liraglutide, and I got very familiar with it. I would give it quite a lot of my family practice, only indicated for diabetic patients at the time. But patients would come to me and say, can they please have it off-label to help them lose weight? And I found at that point that people who use it as prescribed for their diabetes, their sugar would be better controlled, but the weight loss was not as impressive. Now with Ozempic, we've seen impressive weight loss. And that's why it became so popular, just because the weight loss is so dramatic. Then initially, when I started my lifestyle medicine clinic, I didn't want to put people on Ozempic. My goal was for people to change their lifestyles, to sleep better, the whole cortisol effect that you were talking about, to sleep better, stress less, spend more time in nature, move more. That was really what I was passionate about personally. However, Big clinical trials have now been done showing that GLP-1 receptor agonists are really safe, and they work very well if you choose it correctly for the right patient. So it's not necessarily safe for everyone. So I don't recommend people get it over the internet, and we'll talk a little bit about that later. But if your doctor has told you that you should go onto a GLP-1 agonist, you might want to consider that, because all the data that there's a big 4-year study that has been the trial that has been released now, that we saw it is actually much safer than initially thought. So the FDA really wants all diabetic drugs to look at all the other things that typically get affected by diabetes, like how does it affect heart disease, how does it affect your risk for stroke, how does it affect the brain. So they looked at all these other things that is not necessarily intended for, but as they were researching the other things, we saw more and more benefit of the medication in people using it, and not only benefit of losing weight. Because typically, if you are at a higher weight, you would be more sedentary, then you'll be less active, you'll be at a higher risk for heart disease or dementia. But we've now seen benefit outside of the weight loss. They We feel that maybe there might be anti-inflammatory properties to this drug, reducing the risk of stroke, reducing the risk of heart attack. And it really so far looks very, very, very good. So to simplify it as much as possible, a GLP-1 agonist is something that naturally occurs in your body. That's when people talk about natural Ozempic, they're often referring to this hormone that we all have in our body. In our body, GLP-1 receptor or the medication, the GLP-1 receptor agonist, mimics a natural hormone that you have in your body that gets secreted every time you eat. So every time you eat, in your gastrointestinal tract, a hormone gets secreted. That hormone then goes to all the different organs. It goes to your brain, telling your brain there's food. Um, my stomach is getting full, you can stop eating now. It goes to your pancreas to say secrete more insulin to help digest the food. It goes to your liver, it goes to your muscles, it goes to all your different organs. So the same happens with this drug, but 1,000-fold higher concentration. So people who typically use this drug will eat and then they will feel full. At maybe a quarter of a meal or half of a meal, they will feel full. Something else all my patients tell me is that it really quiets the food noise. So typically, we will be thinking the whole day at work, you'll be thinking, what am I going to cook for dinner? What am I going to have? But we call that food noise. When people go onto the GLP-1 agonists, it stops that food noise. So people don't think about food as often. Then it so usually when this gets secreted, your pancreas makes insulin. Insulin goes up and then glucagon goes down, the hormones in your body. So if you just think about how your natural hormones affect that, that will make sense then if you think if you are on this medication, there is an increased risk of getting inflammation in the pancreas. It's very low, but where I work in the hospital, if someone comes in with pancreatitis, and they are on any of these drugs, I immediately tell them to stop their Ozempic in someone with pancreatitis. Even if I don't necessarily know if their liver enzymes that are up or the pancreas enzymes that are up was definitely in this case caused by it. That's just a logical response. If you look at how the drug works, is it does put you at risk of inflammation in the pancreas. So then the next thing is it makes your glucagon goes down. It tells your stomach to delay emptying. And then, so that's the mechanism. That's how it must work. That is why it is how people lose weight. But then on the flip side, that also will cause a side effect. That delayed emptying can make people, for example, when we operate on people, we tell them to stop their Ozempic 2 weeks before an operation because of this delayed stomach emptying, or if they get admitted with bowel obstruction, first thing we say is that it may be delayed gastric emptying, delayed peristalsis. So this might have caused a presentation looking as if you have bowel obstruction. So although these are rare, these are the side effects that one do get when people start on a medication, a GLP-1 agonist medication. So even though we see great results, even though they do work, even though people do very good on them, it doesn't mean that they're risk-free. We don't really have such a thing as a medication that we can take that's completely risk-free. So the other names that you might see, and then it also depends on the concentration. So the questions that I'm getting at the clinic is always around Ozempic. Ozempic is just a brand name, specifically for the drug that was FDA approved for diabetes. And your health insurance will only cover it if you're a diabetic. Then exactly the same company made a different brand name for the same drug, the same ingredient, and that is Wegovy. And that one was studied specifically for weight loss. So you can't just, when you see that a drug works well for something else that you study it, just use it for that. You have to put in new trials to get FDA approved. And that's what they did. So Wegovy, but usually if you use it for obesity, you have to use it at a much higher dose than we typically do with Ozempic. Then thinking how this works in your body, your GLP-1 receptor, the semaglutide, works on your stomach and your gastrointestinal tract. So some people experience some nausea and vomiting, some constipation, some diarrhea. Usually these side effects can be minimized if we just personalize the dose, play around with the dose, and start with a lower dose and then slowly upregulate it. It has an effect on your pancreas, as we mentioned. It has an effect on your liver, on your brain, on your muscle, on your fatty tissue, which is fantastic. That's where we get all the benefit, how it burns more fat. It does have effects on your kidneys. It does have effect on your heart. And we see that people are having less heart disease, which looks very good at this point. So even though it was originally designed for diabetic patients, we've now studied it enough people who are non-diabetic who are using it for weight loss with great results. It is a once weekly injection, Ozempic or Wegovy. But then they also have an oral medication, and the oral medication, Rybelsus, is a semaglutide tablet that you can take daily. There is a daily injection as well, which people don't like as much, and a new injection that's going to come out next month and next year, which is a monthly injection. So these drugs do work. It does bring your HbA1c, which is your diabetic marker, down. It does lower blood sugar. It does lower weight. It is approved in Canada. So it really looks good. The cons of this medication is that it's quite expensive. And then, as we discussed in the beginning, is a big question that people would ask is, how long do I have to be on it? And if I stop it, am I going to gain weight again? So if you look back at why you started it, if you started it for diabetes or obesity, which is a chronic disease, this injection is not a miracle cure. It doesn't stop the disease process. So we would often see the drug is very successful. That's the closest you can get to a gastric bypass, but exactly same as a gastric bypass, it doesn't cure obesity. Many people lose a lot of weight and they're very happy, but many people after a gastric bypass gain again their weight 10, 15 years later. And the same is what we see with Ozempic. Is some people will lose quite a bunch of weight, but then when we stop it, because it really suppressed your hunger, you are not aware of the need that you need to eat. So you have a very high risk that after you stop it, you'll become very hungry again. And that message might be even stronger, saying, I need food, I need food, I need food. And some people describe that they're more hungry. So at my clinic, when I prescribe it, I'm very, very, very strict that I only prescribe this medication if they work with a dietitian or a nutritionist and a health coach. And everything, Laura, that you covered is what we teach people then, where we look at exactly what you're eating, because the goal with this medication, my goal with this medication, is really just to help people who's been dieting their whole life, who feel they've done everything and nothing helps them to lose weight, to get over that mountain and start losing weight. But while they're doing it, to implement lifestyle changes and to implement healthy eating. All of these things are habits. If you use a drug for 6 months to help you, but it's much easier to stick with your diet because you don't get hungry and you don't feel like eating. So then it's much easier if you food prepped on a Monday and you have all your meals to eat it exactly the way that it was planned for you. I also always make sure that when I see people, I do a proper intake. I look at thyroid illness, hormone replacement therapy, the whole person, are they at a genetic risk of being overweight? Do they have the other things that this person have? It doesn't help for most people to just lose weight. Quite often there are multiple other medical issues that we need to address. So to be able to come off this medication, we need to address any genetic things, medical issues, and lifestyle things. And then typically my goal for this medication is just to help people implement their healthy lifestyle changes and then to wean them off the medication once you've implemented those healthy lifestyle changes. So serious concerns that we do have with this drug, two big ones. The one is that it can cause thyroid tumors, and one of them is a very rare thyroid cancer that it can cause. And then the other one is I also don't give it to people with a personal or a family history of multiple endocrine neoplasia syndrome. We shorten it by saying MEN2 syndrome. And so this medication is not risk-free. And unfortunately, we have no medication that's completely risk-free. It's an absolute game changer for many patients. I've had patients lose 70, 80 pounds on this medication. But then same, I've also had patients without this medication lose 70, 80 pounds. So you don't have to use this medication. It does make it a lot easier though. Something else you would have seen quite a lot on Insta is natural GLP-1 inhibitors. So what is this? So as I said, GLP-1 agonists are something that your body naturally secretes. So a lot of the things that we talked about, for example, intermittent fasting can increase insulin sensitivity, can promote glucagon release in your liver and in your muscles. So this is an effect that you get from Ozempic, but you can also get the same effect from other things. There isn't really something, as this drug is like 1,000 times higher than that in your body. There isn't really something that I'm aware of that you can say, oh, this is a natural Ozempic. You can say this is a natural appetite suppressant, or some of the features that Ozempic have. You really have to break it down. What does this drug do, and what is your pharmacological effect, and what is the physiological effect? So I assume when most people talk about natural Ozempic, they talk about the physiological effect, and that is a natural hormone in your body that your body secretes to suppress appetite, to make you aware of your satiety, so you don't keep eating. We all have that in our body. So and something else that we see on TikTok quite a bit is microdosing. I didn't know how effective microdosing would be, because if I look at, I need to use a much higher dose with my weight loss people than with diabetic people. So to think about what the word micro mean, so you want to use a dose that's about 1,000th as strong. You will have to use it through compounding to be able to get it at such a low dose, and then it would, I believe, would be very similar to what you naturally have in your body when you do secrete this hormone when you've eaten something. Another benefit that I see is less alcohol consumption, and alcohol drives weight gain, whether it's the beer or whether the alcohol just causes a different lifestyle. Because for most of us, after a few drinks, you're not going to go home and make yourself a salad. Most people, after they've been out with friends at night and had a few cocktails, you would more naturally crave chips or McDonald's drive-through. So alcohol has two components of pushing weight gain. Oh, actually, three components. Then how it acts in your liver as well, and it impairs your liver's ability to help you metabolize fat. Okay, so but then the good thing is with Ozempic, people typically stop drinking alcohol, which is very helpful. I see the other thing is when people start losing weight, they have less sleep apnea, so they sleep better, and that's that whole cortisol effect you were talking about. And then as soon as there's less cortisol secretion, people also burn fat, so it's really like kind of a positive spiral effect for many people. We have a little bit of time, so I'm gonna tell you about a couple that I started on Ozempic 4 years ago. So typically at this lifestyle medicine clinic, I only put people on it when they've seen me and did a body composition analysis. And I encourage you, I know people from all over is watching this tonight. So make sure you go to a place, a local gym, somewhere where you can do a proper body composition analysis, where you know how much is fat, how much is muscle. All of us lose muscle when we lose weight. It's very natural to lose. So it's not Ozempic's fault. It's always when we lose weight, we're going to lose muscle as well. So you have to work double hard by having adequate protein, as Laura said, and also doing muscle strengthening exercises to build muscle while you're on this drug. So that's why at my clinic, I don't give the drug, we don't provide the drug online. We only do it if people commit to work with a nutritionist, with a health coach, so that we have these other steps in place so that you can stop the drug after a year or two, and we help you to slowly wean off this drug. But I have this lovely couple in my clinic, husband and wife, who started on Ozempic. So for the wife, became a type 2 diabetic. They were both very overweight, but they were otherwise healthy. They were overweight, and he became pre-diabetic. So he didn't qualify for Ozempic. His health insurance wouldn't pay for it because he's not a diabetic. Their health insurance paid for hers because she was just diagnosed with type 2 diabetes. They went on this medication. They lost a lot of weight. Even after a year, I think it was like the one 50 pounds, the other one 40 pounds. And then at 18 months, they were at their goal weight. Then he stopped the medication. We had it compounded for him because it was so expensive and he had to pay cash for it. He stopped it, and this is now 2.5 years later. He gained about 10 pounds again, and I think in total he lost 50 or something. And he's quite happy, even though he gained 10. He knows it's from drinking beer or this or that. He's very happy with his current weight. He's not interested in going on to it again. The wife, when I started her, she was within 10 years of her menopause. So I started her on hormone replacement therapy. And all these things play quite a significant factor. So we started her on hormone replacement therapy, helped her to sleep better, started her working out with a personal trainer. She's never seen the inside of a gym before, but I said that would be the only condition that I would work with them. We got her on a protein shake because she's like most women, right? We got socialized in a way that it's okay for guys to eat steak, but women typically should have a salad. So she was kind of socialized in that environment. So for her, it was hard to push up her protein. Added a very good pea protein that she's still taking. She lost weight. She refuses to go off Ozempic though. And as I go with her through all the risks, maybe it's not good to take from her perspective. She's now 68. From her perspective, her whole life, she's been dieting, losing weight, gaining weight, losing weight, gaining weight. She knows when she stops the drug, she will gain weight again. So she prefers to stay on the drug rather than being overweight again. So I don't necessarily think I agree with it. They certainly benefit from a diabetes perspective to be on this drug. She's at a much lower weight than she's ever been in her whole life. So from my perspective as a doctor, when I have to refill the prescription, I'm like every time, really, don't you think you should come off this? Don't you think you should come off this? Is your weight not too low? And I will only give it if she comes in so that I can see that her muscle mass is optimal. Because for longevity, that's quite important, right? You need your muscle mass to be normal and your body mass index to be normal. And she doesn't have osteoporosis. but she knows she's going to be on that for life. So even though the whole goal of my clinic is to help people just for that 6 months or a year to get to your goal weight, to get adjusted to the healthier lifestyles. And then also from her husband's perspective, because in their family, the wife is the one who was always buying the food, saying, "Oh, let's go to a restaurant." They now have healthier food in their house because she doesn't have that food noise. She's not thinking about food. She's not feeling like snacking, so they don't have snacks in their house. So they have way healthier choices that they make now, thanks to this medication that she's on. Um, we have longer data now that people, and we've certainly with diabetic patients have data from 2005 who's been on this drug. So it's not the best drug for everyone, but certainly it can be very helpful for many people, and it can be a complete game changer for many people. And I'm open for any questions if you have any questions for me. There's a lot of resources available on my website. You can have a look at www.wellnessmdhealth.com. Our free resources available there. All of you watching today, if you email me info@wellnessmdhealth.com and subscribe to my newsletter, then I will give you a free access to our Menopause 101 information, like your basic 101 things that you need to know about menopause to really thrive through menopause. You can have free access to that. You can subscribe to my YouTube channel. I have a great YouTube video with Dr. Julia Fontaine on there that I've had a lot of positive feedback from that people are like, oh, now they understand when they should use hormones or when not. So you can really have a look at my YouTube, have a look at my Instagram, my podcast, and thank you everyone. Thanks for giving your time tonight. I appreciate that. I hope everyone learned something that they can take home with them.
Thank you so much, Dr. Steyn. And I'm thinking I'm going to go ahead and just ask one quick question, if you don't mind, and that is, can you explain to us how people see you? So it's different to go see you than their family doctor, and,
Yes.
and would you replace their family doctor, or the logistics of how people would book with your clinic?
You can get a referral from your family doctor. So you can get a referral signed by your family doctor, then you can come and see me. Unfortunately, OHIP does not pay for our health coaches and does not pay for our nutritionist, dietitian, like nowhere else. But my one consult with me is covered if you get a referral through OHIP. If you can't get a referral through OHIP, then you can see me for with private pay. And then I do have some concierge patients, people who I've walked this road very closely with, who would maybe then lose a ton of weight, and I would say, oh my goodness, get pain, and I would say, oh my goodness, it's maybe because of all this weight loss, maybe you have like gallbladder gallstones, you should get an ultrasound. And at that point I am comfortable to taking over the role of a family physician if need be, but that's really on a case by case that I have been providing concierge medicine. But you can definitely see me with a referral from your family doctor.
And we have a question along those lines. Is there an easier way to find a doctor who specializes in perimenopause, as most GPs do not have the knowledge and will not prescribe?
No. So, Julia, you are a member of the North American Menopause Society, right? So they have now menopause.org, a place where you can find, they changed their name to menopause.org. So you can go on there and find a provider. So those are people who specifically said they want to learn more about menopause. So they have their names on the website. Or you can Google. I see a lot of people now started just adding that menopause clinic, and I certainly did the same, to just add menopause clinic to your clinic's name, and then it's easy to see who is providing, more eager to provide help during menopause.
See too, like on the Menopause Society website, or the formerly NAMS website, there's actually more NDs that are Menopause
Yes.
Society certified than there are MDs,
Yes.
particularly in Ontario.
Yes, you're right.
And naturopathic doctors in Ontario, again, as long as they have a certain prescribing license, can prescribe hormone therapy for peri and postmenopause. However, again, it's different than your GP, because any lab work that we order is not covered through OHIP.
Yes.
Our visits obviously are covered through Extended Health, but not by OHIP. And we don't have the full range and scope of everything else as far as imaging goes that your family doctor would have. But I'll tell you, I see a lot of women for perimenopausal care who are also seeing their family doctor jointly. And whatever I can't do, their family doctor is doing. And if their doctor's not familiar or comfortable with perimenopausal care, then they're quite on board with me managing that end of things. So, yeah, I mean, there's certainly ways to work with that. And I will tell you, too, like sometimes you get a referral to a gynecologist. Not even all gynecologists are all that well-versed as well either on perimenopausal care. You know, it's unfortunately, it's just kind of the way
and
it is.
then even if you have been referred to a doctor, just because I can't always take all the referrals, I've then referred to other gynecologists in the area who I know who can prescribe. But I've had those patients still stay on my waiting list, and then by the time they come and see me, they'll say that, okay, your clinic said you have a long waiting list, we should see this gynecologist, you know, that we pushed the referral there. They went to the gynecologist, they got prescribed the medication, filled it, never took it, waited another 3 or 4 months to see me, to first hear my opinion before they take it. So, and that really made me reflect and think, you know, and I think that it's also because it's such a big decision. I think it's important for women to be with someone that they're comfortable with, that they trust. So that plays a big role.
Especially since perimenopause takes about 10 years for some women.
Yeah.
It's not just a one visit and it's done kind of thing.
No, yeah. And that's
so if anyone has questions, please type them into the chat, and Dr. Steyn can maybe monitor the chat and help to answer your questions there.
I'll do that.
But thank you very much. That's awesome.
Thank you for listening to this episode today by medical doctor Daniela Steyn. Follow us on social media and subscribe to our newsletter at www.wellnessmdhealth.com to stay up to date on educational resources that will take your quality of life to the next level. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your healthcare provider. Never disregard medical advice or delay in seeking it because of something you have heard on this podcast. Remember, you are created to thrive.